After successful completion of the breathing circuit test, please continue with the patient admission. In the Evita ventilators, you can choose between 3 different therapy types: tube for intubated patients, non-invasive ventilation, and O2 therapy. In this scenario, we want to ventilate an intubated adult patient. The ventilator will start with pre-configured ventilation parameters. If configured in advance, you can enter the height of the patient, and based on the ideal body weight, the pre-configured parameters will be adapted. If you want to make individual changes, you can select the respective parameter, turn it to the desired value, and confirm with the rotary knob. If you want to start ventilation in a different ventilation mode, please select the ventilation mode and confirm with the rotary knob. Before starting ventilation, please check whether the alarm settings are appropriate for your individual patient. If you want to make individual changes, please touch the respective field, select the respective alarm limit, and turn it to the desired value. Afterwards, we can start ventilation by simply pressing on Start Ventilation and confirm with the rotary knob. Now we will show you how to adapt your ventilation settings in operation. On the top, you can find your patient category and your respective ventilation modes. You can adapt your settings for your ventilation mode in the lower part of the screen. Centrally, you can see your waveforms and measurements. On the right-hand side, you have further submenu structures and configured functional keys. If you want to adapt your ventilation settings, you can simply press on the respective parameter, turn it to the desired value, and confirm by pressing the rotary knob. If you want to change to a different ventilation modes, you can either choose Run from the pre-configured list, or you can choose another ventilation mode over that list here. Simply select the ventilation mode and activate it by pressing the rotary knob. In this example, you can see 3 waveforms and measurements. If you want to adapt the respective waveform, simply press the field and choose from the list. According to the same principle, you can select a different parameter for the measurements. If an alarm is present, the ventilator will give you an acoustical and visual signal. Please check the patient condition and the condition of the breathing system. However, it might be necessary to adapt alarm limits during operation. Please press the respective parameter to enter the alarm menu. Select the alarm limit and put it to the desired value. You can confirm by pressing the rotary knob. If you want to change the therapy type to non-invasive ventilation or O2 therapy, please select Other Modes and change therapy type. If you select non-invasive ventilation or O2 therapy, the device will switch to standby and the patient is not longer ventilated. You can then change the equipment. If you want to end the therapy in general, please select Stop Ventilation and confirm by pressing the rotary knob. A red alarm will indicate that the patient is not longer ventilated.